There is something common among all of us. We all work in a factory and we usually come across hypertension each and every day among the factory workers. So in this video we are going to talk about hypertension awareness, its understanding, prevention, controlling high blood pressure. Hello everyone, my name is Dr. Snehil Pancholi and let's hop on to this video. What is hypertension? So we will just define what is hypertension. First of all, just it is the persistent elevation of blood pressure. I repeat, persistent elevation. Persistent means continuously the blood pressure should be high. High means more than or equal to 140 by 90 millimeters of mercury. This is the current clinical guidance. So 140 by 90 is the cutoff limit for blood pressure. More than or equal to 140 by 90, and it should be continuous, persistent. Persistently the blood pressure should be more than this. Then only we will call it hypertension. Keep this in mind permanently now. So why is hypertension important? Because it is a silent killer. It may not cause symptoms until complications occur. It is basically a silent killer. It keeps on killing you silently inside only. So it is called silent killer. It cannot manifest in any form of symptoms until the complications occur, usually. So now we'll see some risk factors. Risk factors for the hypertension. First of all, age. Usually we come across hypertension in more than 45 years of age. But among the factory workers, usually we use 35 years of age as the guideline. More than 35 years, then you need to measure the blood pressure for all the candidates. If he has any family history of hypertension, then it is a risk factor. If the person is obese, then it is a risk factor. High salt intake is another risk factor, you already know. So you need to ask the candidate to decrease the salt intake first. Stress. Stress is another risk factor. Any kind of stress, mental stress, work stress, family stress, financial stress. So the candidate should be asked to relax, meditate, get relief from all kinds of stress in his life. Don't think about it. Sleep properly. Watch less mobile. Next we will see smoking. Smoking is another risk factor. So you need to decrease the smoking, decrease alcohol intake, no smoking, no alcohol. Diabetes is another risk factor. Blood sugar can rise, that increases the hypertension also. So keep the blood sugar under control, don't eat too much sweets. Lack of exercise. Sedentary lifestyle is another risk factor. You already know about it. So mild regular exercises are very important to control the hypertension. Now we will see common symptoms. Usually there are no symptoms for hypertension, but sometimes headache, dizziness, blurred vision, chest discomfort, all these symptoms can occur. Now we will see some complications of hypertension. What all can occur? Heart attack can occur, stroke, paralysis, kidney disease can occur, heart failure can occur. Heart failure means you usually find edema all over the body, papillary edema, then tibial edema, pedal edema. Next, we will see some vision loss can occur because of hypertension. Peripheral vascular diseases like varicose veins, arterial hypertension, all these kind of things can also occur. So these are the complications. Now we will come to how to measure BP. So first of all, rest for 5 minutes, sit comfortably, avoid caffeine, smoking before measurement, use correct cup size. Now we'll see healthy lifestyle. This is already, you already know. Healthy lifestyle prevents the hypertension, reduce salt intake, eat green vegetables, fruits, fresh fruits and vegetables, lot of fruits and vegetables, exercise regularly, even mild exercise can do. No need to jump straight into heavy workouts. Mild exercise is regularly sufficient. Maintain healthy weight, manage stress and sleep well. That's it. So now you need to avoid tobacco and excess alcohol. This is very easy to apply in life. Quit smoking and limit alcohol consumption to reduce cardiovascular risk. As simple as that. Why to fall into all these things? Okay, so now medication adherence. Take prescribed medicines regularly. As the doctor prescribes you the medicine, you need to take those medicines regularly. Do not stop treatment without medical advice. Without medical advice, do not stop the treatment. Even if you want to change the medicines, then also you need to speak with the doctor. Okay. So now we will see when to seek medical help. When to seek medical help in hypertension. So very high BP is indication for seeking the medical help. Chest pain, if someone is having, then you should seek medical help. Severe headache, weakness, breathlessness, vision changes, all these things happen, then you need to seek the medical help. So now we will come to key takeaways. Key takeaways from this presentation. So first of all, know your numbers. BP, how much BP is there every day. Check BP regularly. Follow a healthy lifestyle and take medicines as advised by the doctor. So healthy heart, healthy life. Thank you all. This is all in this video. Hope you all enjoyed it very much. And it was the hypertension awareness program.